Strange political moment this, as infections rise, particularly at the scale at which they're going up at the moment. You'd expect restrictions to be going up or at least stabilising. To an extent today, we saw a slight relaxation of restrictions. Boris Johnson would say that's because the jabs are going so well, but the truth is he has very little room for manoeuvre. Some ministers are now talking openly about how they pushed back against the Prime Minister before Christmas when he was pushing for something harder than the Plan B that we ended up with in England, compulsory masks, work from home guidance. And then, of course, that Plan B itself triggered a 100 Tory MP rebellion. It's hard to see today how, even if at the end of this month, when Plan B is supposed to be renewed, if Boris Johnson thought it needed to be renewed, he'd have the political space to do it. A paramedic tweeted these images last night from Torbay accident and emergency. She counted 19 ambulances queuing and patients waiting to be offloaded. The latest government COVID figures show 1 in 15 people in England infected. The Prime Minister said further COVID measures were not required.
I'm confident that we can get through this wave of Omicron with the measures, with the balanced and proportionate approach that we are taking.
London commuters staying away from peak time trains this morning, observing the government Plan B guidance to work from home. But today's figures show that hasn't stopped infection levels in the capital reaching 1 in 10. Since the beginning of December, the government's COVID infection map shows blue areas with lower infection rates turning light purple, showing much higher rates. Many are now dark purple, areas with the highest infection levels ever known. Those infection levels mean new arrivals at the hospital door, just as hospital staff are themselves having to isolate with infections. 24 critical incidents have now been declared at hospitals across England, including these ones. Standing in for the Labour leader, who himself has now tested positive for COVID, his deputy accused the Prime Minister of complacency.
The Prime Minister has said we have to ride out this Omicron wave. But the NHS isn't surfing. It's struggling to stay afloat.
We're hearing 24 critical incidents around the country. What's the truth of it? How worried should people be when they look at this map that we're seeing at the moment?
When hospitals declare a critical incident, it's really a signal that they need to mobilise all the staff that they can and that they won't be able to provide the full range of services that they want to provide. But what you're seeing in those critical incidents is true for the health system as a whole, not just hospitals, but community provision, mental health, primary care. We have a system under immense pressure.
Because of the success of the vaccination drive, the Army helping deliver booster jabs in Portsmouth today, the government's hoping it can avoid tightening restrictions. And today actually relaxed some testing rules. Travellers no longer need to test before returning to the UK. And PCR tests no longer are required to confirm a lateral flow positive test. Experts say that's in part dictated by the daunting scale of the current infection wave.
250,000 cases of COVID every day, and you can only test 800, 900,000 people. You can't do community PCR testing for that disease any longer. So it was always going to happen.
In the Commons, Tory MPs were keeping up demands for a route map to remove all COVID restrictions.
It is not in the national interest to partially or wholly shut down sectors of our economy every time we see a new variant. So will my right honourable friend take this opportunity to inform the House as to whether and how the government will be changing its approach when new variants arrive?
He'll know, as I know, that the public are now yearning to know when we're going to get back to the old normal. Investors need to know, the wider public need to know, and every business person in the country needs to know when the sword of Damocles won't be hanging over them of further restrictions. Will you please bring forward a plan to get back to the old normal?
As Omicron blows through, and it is very much my hope and belief that it will, I do believe that we will be able to get back to something much closer to normality.
COVID absences have reduced some bin collections in council areas like Birmingham and impacted train services, supermarkets, staffing and teacher numbers. The old normal might feel a long way off for some time yet.
Well, the current wave of COVID has forced around half of the care homes in Greater Manchester to stop accepting new residents due to staff shortages. The knock-on effect is that some 650 people remain in hospital who are fit to be discharged. And meanwhile, 1 in 7 NHS staff are currently off work across the city. Manchester's Mayor Andy Burnham warned today of a very challenging month ahead. Our North of England correspondent Claire Fallon reports.
The Christmas lights are barely down and it's another new year with COVID. Another new variant, though without the lockdown. With many more people getting COVID than seemed imaginable not so long ago. In some places, the number needing to be in hospital is going up fast. But the pressure is not just from the number of patients, it's also the number of staff.
Things are difficult right now and could get more difficult as we go through this month. As we all know, schools have returned this week. I think there's perhaps some implied complacency in the ride it out phrase, or it sounds a little blasé, and that's not how the mood is in Greater Manchester at the moment. It's vigilant, it's concerned. There's not as I said before Christmas, a wish to rush to restrictions. That's not where people are. But it's about taking sensible steps.
Good afternoon, how are you?
I'm good. How are you, more to the point?
A bit of a raspy voice and feeling proper guilty about not being in school tomorrow.
One of the 1 million plus who've tested positive in the last week. Glyn Potts is head teacher at a secondary school in Oldham.
The one thing you want to do is you want to be stood on the gates on the first day, smiling, even if you have got to wear a mask.
With 17 members of staff at this school isolating because of COVID, the head teacher told me he thinks more can and should be done to keep as many children as possible in class.
It does feel sometimes that we're lurching through the crisis rather than having a considered look. Let's sit down and have a grown-up conversation about how we manage it. Bringing retired teachers in, as admirable as it will be, does not necessarily remove the fact that many of these young people are now studying curriculums and examination processes that were not around when teachers were previously in the profession. We need to talk about the long-term solution, not the headline.
There has been a fair bit of talk in recent days about data showing positive signs and cautious optimism that this peak might have been passed and we can ride a wave, as the Prime Minister put it, out of Omicron. But an increasing number of workers in the health service and social care in some areas are saying it just doesn't feel like that where they are. In Greater Manchester, most of the hospitals are now cancelling all operations considered not urgent. There are plenty of people now saying that the talk of corners being turned and riding waves just feels too optimistic and not cautious enough. And then there's care homes. Cases among residents are still low, very low compared to the first wave, but rising. And a leading figure in the sector who represents care homes in Yorkshire warns staffing levels are reaching a critical level.
Having enough staff to deliver safe service is the critical bit for us at the minute. And the way things are going, we're getting very close to not being able to operate safely. The issue for us is that the health service is short of staff, local authorities are short of staff. There's no one out there to help us, which is why I relieve my call to the Prime Minister to say, actually, could he ask the public, if push comes to shove, if they could help us?
To coexist with COVID, it is in part about how many cases. But in the next few weeks, it could again be about how many in hospital and who can and should keep going to work.